if we could start talking about mental health in general and what you find or have found in the profession, I guess in the medical profession. I know that's a really broad statement, but what have you found around mental health?
Look, I think mental health has evolved in the medical profession, and probably more so over recent years. It's never been, I think, historically and adequately focused upon from the point of view of well-being, taken over by things like progression in training, study, all those sorts of things. But in the last few years, after a spate of junior doctor suicides, which highlighted mental health issues that were percolating in medicine, RPA, where I work, developed a mental health program called MD-OK, basically off the back of Are You OK, to promote acknowledging and delving into the mental health needs of junior doctors. But then I think that probably will over time engage and encourage more senior doctors and other staff in the hospital, nurses, allied health, admin staff, to really acknowledge the importance of our mental health, particularly working in health, where we can become sucked into, medical illness and organic disease, as it's called, versus acknowledging how much mental health does mean to us on a personal basis, on a basis if we've got medical problems ourselves, and on how we can perform our job. And so that's, I think, for me, being involved in that process has really changed the focus significantly. We dress up every Friday in a different theme to acknowledge mental health needs of doctors. We all get together, we have a laugh. We've slowly realised how uplifting that can be, even if it's 20 minutes of your week. And we've engaged in our department all staff, junior doctors, senior doctors, admin staff. And that really has, I think, opened the door to the conversation, allowed us more readily to talk to our junior staff. How are you? What's happening? There's a much more open conversation if we think the junior doctors are struggling with something, that we will sit down and openly say, are you okay? What's happening? Is there something going on? Because more often poor performance or poor work attendance or issues like that, particularly with regards to medics, I think is more often due to unrecognised, mental health support needs than other factors. Which, because you are clever, capable, young doctor who's out there, showing the world what you're made of, can be something that you really do keep very close to home. And although that's fine, and this is private stuff you only want to share with a few people, there's a difference between privately sharing with a few people and just holding it in and not acknowledging it. Because then that seeps into your individual performance, it seeps into your relationships and makes you sad.
I guess something that I've noticed over the years is the stigma that's attached to mental health. And being a mental health professional, I have a space where that's what we talk about pretty much every day with my clients, and even if I'm out educating others around mental health. But if we go to the topic of suicide, because that's what you've mentioned with the MD-OK initiative, and then you started to talk about, how we view medical practitioners in society as, having it all together and, highly intelligent, hardworking. I imagine in the school environment, they were the ones that were doing all the studying for the HSC, all that kind of stuff. So we tend to have this view which almost sets up the profession in a way that they're not allowed to have a mental health concern, or they're not allowed to get to that point where they are struggling with one of the things like, anxiety or depression, which are so common in society, or even at some point having thoughts of suicide. So do you feel, what's your thought about the stigma around that, particularly in the medical profession?
Yeah, look, I think I agree. There's stigma in the general population, and more so, as you point out, in apparently intelligent, high-functioning people who sort of get on with it for the most part, even if they are struggling. I think the stigma is probably long seeped in tradition and our view of mental health problems. I mean, when you go back and look historically, people with, mental illness, people even not with mental illness, with physical disabilities like epilepsy, but they thought it was people being possessed, were shunned from society. It's taken a long time for us to slowly make that not something that should be shunned, but something that we acknowledge is much more common and is something we need to deal with. The medical profession is tricky for all the reasons you said. I think things like the MDOK initiative are really important. I think probably that needs to be spread across the board, and I imagine but don't know what the curriculum's like currently with medical students, but I suspect that introduction of more sort of focus on self-care and mental health will be moving its way into education at that level. You know, get people early, educate them, make this an acceptable part of you and your profession, and then hopefully that will, you know, infiltrate into the profession overall. But yeah, it's tricky based upon that stigma, and we see the same thing with patients. And I think if you move into talking about patients, it's not just the stigma associated with acknowledging psychological aspects of disease, but it's also our skill base with actually dealing with that. You know, you're a psychological professional. You know, this is what you do all the time. You know how to raise things and talk to people and what it all means. I have an interest in that and have done quite a lot of reading and research in my work in epilepsy particularly, but I'm not, you know, other people have interests in, you know, lab-based research or imaging when you come to look at doctors. So I think from the point of view of how we transmit the importance of this to our patients as well, it comes down to both the stigma and trying to lift that away and make mental health or your psychological well-being a part of your medical management from day dot, and also looking at who's got the skill set to do that. And if the doctor who's dealing with the medical condition doesn't have that skill set, then we need to improve the allied health services we've got to make it a part of care in general, which has been notoriously a terribly badly funded and provisioned area in medicine. Even mental health services, I mean, the mental health professionals where I work really hard, but there's just not enough public service mental health available to fill that gap.